Nothing is impossible. The word itself says I am possible. With this beautiful quote, I, Sukshma, NSS Coordinator, Hindustan First Grade College, Mysuru, greet a very good morning and a warm welcome to you all, the participants to the webinar on Wound Care Essential during COVID-19. Deeply inspired by our founder, Dr. Varghese' vision to make every man a success and no man a failure, we at the Hindustan First Grade College try to leave no stones unturned when it comes to learning new things and trying out new avenues of knowledge. Thank you all for joining us for today's webinar. It's an immense pleasure to witness the participants from various colleges. I take this opportunity to cordially welcome the resource person, Dr. Mir Zeeshan Ali, MS, General Surgery, Healthcare, Germany, Innovation Healthcare, Johns Hopkins, USA, to this session, Wound Care Essential during COVID-19. Welcome you, sir.
Thank you.
I extend my warm welcome to our principal, Dr. CJ Priya. Welcome you, ma'am.
Thank you, Sukshma.
I would also like to extend my hearty welcome to my colleagues, students, staff, and all the participants of this webinar. I request all the participants to mute audio and video to have the better experience. Here are the few instructions to be followed by the participant. If you have any questions during the presentation, please type them into question box in your control panel. Now, without further ado, we will turn the time over to our today's presenter, Dr. Mir Zeeshan Ali. Dr. Mir Zeeshan Ali is the consultant general surgeon. He has done MBBS and Masters in International Healthcare Management from Germany. Johns Hopkins, USA, certified for his innovation in healthcare. Dr. Mir Zeeshan Ali has traveled to 15 countries including USA, UK, Germany, France, Singapore, UAE, and Switzerland, studied their healthcare system and policy. Dr. Mir Zeeshan Ali is also the entrepreneur with founder of iCareforBillion.com. We are very happy to have you with us as a resource person for today's webinar, sir. It's time to enhance our knowledge by being the part of the webinar. Over to you, sir.
Thank you so much, Sukshma. Thank you so much, Ms. Sukshma. It's a pleasure. Firstly, I would like to know that if I'm audible clearly, if it's yes, if you just raise your hands, it would be great. All right. And I'm also clear enough to look at the moment with my quality of video and audio.
Yes,
right.
sir.
Thank you so much. Thank you. So first of all, I would like to thank the First Grade College. Most importantly, it has been a great honor to be here and present in these tough times. I'm not really sure how to begin with, because as we speak, every other person right now who's affected with COVID, who are not in a good state, are, actually thriving to breathe. I think that is one of the most essential part of our life. I would like to begin with, giving you, let's take a moment for about 1 minute silence to all the doctors and all the healthcare staff, the nursing staff, the medical staff, the non-clinical, the clinical staff, and especially the cleaning staff, the housekeeping staff, the marketing, the HR, every department which is working on and off, and also who are non-medical staff, who are volunteers, the front warriors, everybody who have lost their life in these COVID times. I would like to request all of you to have 1 minute silence so we can just remember them and pray to them wherever they are, whichever star they have converted themselves to let them rest in peace. Thank you, ladies and gentlemen. Thank you very much. What really, when we closed our eyes or when we opened our eyes, the only thing that was happening to us was we were breathing. And that was involuntary, and that was happening without our knowledge or with our knowledge. But that is such an important factor for us, for our survival. And this is, today we are living in times, this is what we are fighting for, to breathe. So this is very important. Definitely today's presentation is about wound care, how we would be able to move into management of any wound care that is happening right now in our COVID times. But so let's move on to talking a bit better things. Let's be happy because we have also already fighting. Our country and our world as Earth is definitely fighting very hard to come out of this pandemic, and it's been very difficult times. But at the same time, I'm very happy to see you all right here online without mask, because honestly, to be really honest, I haven't seen so many people at once without a mask. So I think we really thank you for having me here. It's a great honor and pleasure. It's a fantastic podium, and most importantly, I was told to present. So I know all our students, the youth, the future of our country, our nation, and our world. And all of you are into online classes, and I hope I'm right that all of you are right now in online classes. And most of the time everybody are day in day out a presentation, they're presenting it, and they're making it so difficult in terms of staying online, watching a computer day in day out. Your eyes are burning, the heads are turning red, everything's going upside down. But the positive side to it is, no matter what, we are still all are together. So with this note, I would, also want to tell you that I don't want to do any kind of presentation today, because I know all the students who are listening are tired of seeing the screens. So let's make it more interesting today. I want to make it very interesting so that you really enjoy what I say. And I want to divide myself into three timing. The first time is where I'll introduce myself, which is already fantastically done by Ms. Sushma, which I'm also going to little stress on few things to make you better understand who I am, why am I here today, and what message I'm going to give you. And the next segment is we need to have a question and answer on. And that's something which I'm really interested to. Like, it's easy for me to put my point view to tell you this is what you need to do. I can guide you to one extent when it comes to wound. This is what my topic for today. But I also would like to listen to 91 members who have just joined, one by one, everybody can ask me questions. And I would really appreciate when you're asking to on your video so I can see you, because believe me, as a doctor, I am looking and waiting to see your faces. That is something we've not seen from past 1.5 years. And right now I can see so many beautiful faces on the screen, and that itself is creating so much positivity in me. So, so that's going to be my second segment. The first is my introduction, and the second, I'll talk about brief about the wound care. And then the final segment is a question answer, the Q&A. Okay. I want most of the students to participate in this. Ask me as many questions you have. It could be in terms of surgical. It could be in terms of any branch. If you have your personal issues also, you can text me. I'm going to give you my number. Anytime you have, I'm always there, because as a doctor, I think that's all my duty is all about, to be there to help and support you. But in the final take, I'm also going to take one promise from you. And that is something which you all have to do to me today. And that is something where we go forward as one people, as one nation, one country, and one world. Okay. So moving on, I'm Dr. Ali, and thank you to Ms. Sushma, who actually, introduced me in a very nice and elaborative way. But one thing, what really stuck into my mind, she said Germany, US, France, Switzerland. It was so good to hear these things, because, honestly, it's so difficult now to even travel to Bani Mantap or even Mandi Mohalla or even Jayanagar. It's become so difficult, and it's so good to hear so many countries at once. And it really reminds the kind of, borders we have been cut out to, and somewhere we have, left out in this corner of the world. But that doesn't mean it's the end of the world. There's a beautiful future for all of us, and that's something we all look forward to. So I'm actually a general surgeon. I'm working in Narayana Hospital, which is in Mysuru, Outer Ring Road. And I'm an associate consultant, but also parallel to it, I've also done my management course. I've done my MBA. I know it's a kind of different, unique thing where a general surgeon doing an MBA course. Why is that happening? I only did it for a reason behind. I've done my MBA in international healthcare. As a surgeon, as a doctor, I have understood and studied about how I am be able to treat my patients. But treating is not the only factor which should come into our minds. The another factor is we need to understand after treating, how's the process that drives towards it. Why I'm telling you, because I also know there are a lot of commerce students, science students. Always have a thought in your vision that it should not be in one podium. See, it's good to have one goal, but to reach that goal, there are times that you need to take different roads to it, different levels to it to reach that particular end point which you really need to. And my whole idea was to give a care to a patient. And how do I go? Is it the only surgical way I can give care, or is there another way around? So another way around is I did my hospital administration MBA course in Germany, where I traveled to about 14 countries. I studied their healthcare system. If you ask me about Switzerland healthcare, I can tell you. If you ask me about NHS UK, I can tell you, because I've studied about all these healthcare systems. So I've kind of understood how the care is. And to be really honest, the care what you're getting in India and the care what you're getting in Swiss or in UK, or even if it's Australia, or even if it's in Africa, it's more or less everywhere is the same thing. There's nothing that is different, nothing that is beyond. So what I'm trying to stress on this, I'm at least in a position to tell you this, it's only because I have understood this. A lot of people say, I want to go to US and get myself treated. A lot of people go, no, I don't see any difference. Honestly, the kind of care we're getting in India is amazing good, because you, with just one message, you can go meet your specialist. Whereas in other country, it really doesn't happen that way. You have to go through a long process. So this is what my understanding was. So I have studied with different healthcare. I came down to India. Then I joined a fantastic organization, our Narayana Health, that, it's been spread across the country. I was quite, immense with what our chairman, Dr. Devi Prasad Shetty, sir, who's the chairman of Narayana Health, with the vision of treating the poor patients, with the basic, availability resources to making use of maximum potential. And that is something that created me, idea like, okay, this is where actually you need to connect yourself. This is where you were able to learn yourself. And that is when I moved into NH, and that's when I joined and I became an associate consultant of general surgery, and also partly being also helping and doing my best as I can as a part of giving my non-clinical background as well. So this is what I am right now at this state. And yes, we are in tough times, but that doesn't mean that we are always in times where we need to think only on that sense. We are also in good times where there's so much of advanced technology which is happening. That brings back to me is about my topic for today is wound care. Lot of people today are experiencing these kind of wound care. Wound is nothing but if you have a skin, if it's opened out, is called a wound. It could be a wound in terms of scratch. I'm going to be in a basic terms for you to understand. Any scratches you get, any bruises you get. And I know it is very less likely in this pandemic, because a lot of students will think, how can we go and fall and, get hurt? Well, it's not really that. It could be in a way where, for example, you have your grandmother or your grandfather, or probably your older parents are at home, who have a long chronic wound in their leg or in their hand. It could be reason due to diabetes, or it could be due to hypertension, or it could be due to probably, older people who are in our houses, they walk and they just hit their fingers or toes into the, any kind of corners of the rooms, or, bedrooms or bathrooms, and they get hurt. So 1.5 years back, before March 2020, anything happens, you rush to the doctor, to the hospital, or to your clinic nearby. But now times have different. Now times have changed. Now it is definitely very important that the first aid care has to be given by yourself. Because even for the smallest of wound or whatever wound it is, it's very difficult to converse. So for that reason, that brings back to me with online consultations, So I'm going to give in briefly about how it works, how you can connect to us or any doctor that matter. Once you connect through online, how the process works. And after that, I'm going to brief you up a bit of what wound is all about. So firstly, we in our hospital, Narayana Rudralaya, we have online consultation, which we have started as a full swing. Every department from most junior most to the senior most doctor in a hospital is connected with online consultation. We have about 20 to 30 years of plus of experiences of doctors in our hospital, where we can, we able to connect you in one go. All you have to do is, I'm going to also there's Mr. Sundaresh also, and marketing is also, I think, with us, and he will be sharing you at the end of the topic, where he will give you a pamphlet through this media where you can connect with just one phone call. You can book an appointment, and once you book an appointment with us, we will connect you, and from there we will guide you through the whole process, how we can connect to a doctor. A doctor will be coming live, sitting right in front of you to make you understand. And also, we are also happy to look forward to is if you have any emergency queries, we'll be sharing you with our emergency contact numbers as well, where you can always connect us 24/7. We have lab, we have, we are operating and we're actually working 24/7. So we are ready to give as much as we can when it comes to times like these. So moving on to wound. As I told you very clearly, the wound is nothing but a break in your skin. It could be any part of the skin of your body. It could be just a break. So the moment this break happens, what you'll have to do is, the first thing that should come into your mind is look at the wound first. Looking at the wound. Most of the time when you get hurt, you just start moving your hands, or, I just got hurt, and you just move your hands so harshly if you get a wound. What you're trying to do is actually whatever wound that has happened to your hand, you're actually trying to increase it by, creating a shake in your blood vessels and artery that is creating to move more further, and you're actually trying to take the blood out or make the wound more bad. So the moment you get hurt, the first thing you have to just look at it first. How big is it? Is it too deep? Is it too cut? Or is just a normal bruise or a scrape that has happened to you? The moment that happens, the first thing that should come into your mind is, if the wound is caused, for example, by a stone or a mud or by a wood piece or by a knife or anything, you have to move away that thing. Okay. Like, for example, if there's any mud or anything that happened, or is there a fire, the first thing you have to do is stop it, get away from it, wherever it is, wherever you are, you have to get away from that place. The moment you get away from the place, see the wound, if there's any mud present, see if there is anything that is present inside the wound that is still there. It's called the foreign body. We call it as foreign body. Foreign body is nothing but something which will be present on your hands, on your body, which is not belongs to you. Now you'll ask me, is the clothes foreign body? We don't call it foreign body. We call it as fomites. Yes, it's a different name to it. It's called fomite. Definitely, we won't say it's a foreign body. So something which has the foreign body, anything, you'll have to remove it out. And if it's a small abrasion or bruise, first thing you do is go and wash it in the tap water. That's the first thing you do. Wash it in the tap water. If it's a small bruise, small cut, you can wash it with the soap itself. Because what you're trying to do there is, when you wash it with your soap, you're trying to clear the area, and probably if there is any small minor infection. See what happens, I'll tell you. That brings back to me is the question a lot of people are using sanitizers. Anything. I know out of 90 people who have joined today, there'll be 20 or 30 people obsessive. The moment they go out and they come in, they want to wash with sanitizer, wash your hands. Those things comes into my mind. I agree, you have to do that. When you go out and come, you need to wash your hands. But if you're in your house, you don't have to keep going and washing your hands, because your skin also contains a normal bacterial flora, which is which is protecting you from other things, it's not an infection, but it's in bacterial, which is also a flora, which is actually covering your skin. That is very good. If you keep on washing hands when you're inside the house, you're actually clearing the flora. And sometimes that bacterial flora, if it's cleared, your immunity of that area will reduce. So that is why when you go out and come, it's good to wash your hands. But once you're inside the house, when you're doing small work, don't keep repeatedly washing your hands, because that will create repeatedly taking shower. I've seen my friends taking shower 3 to 4 times in a day. It's not required. You have to have some, floras in you to protect you, to improve your immunity. So, but the question is, when you have a wound, I told you to wash your hands. Yes, because sometimes the bacteria, your friend, can turn into enemy when time comes. And when there is abrasion, that flora can convert yourself into an enemy. It will only protect before any getting hurt. Like in terms of any other organism comes, that organism will kill that person and help us protect. But if this is open, then that itself, your friend can become your enemy. That is why we need to wash your hands wash your legs, or wash the area of wound that has happened on a tap running water. That is very important. Once you wash it with, most of the time they see, hey, I'll put a haldi akada, we'll go and put the haldi or coffee powder and, yes, it will help. No doubt it will definitely help to an extent, because those things will nothing but will, help your blood vessels to close down. So it will stop bleeding. Yeah, to an extent it will. But what I would prefer is you need to have a first aid kit. Everybody should have two things in their life. And believe me, guys, I saved my own cousin brother when I was traveling in a car. You need to have a first aid kit and a fire extinguisher, small one fire extinguisher in your car. I remember still that day when we were traveling in the car, and all of a sudden from the engine, the fire broke out, and the fire was right inside, in the car. And he was not well because he had already had a burn scar in his neck. So because there was a fire extinguisher, small one, I could protect as much as I can. No doubt, we all got, even if you see my hand is also burnt here. If you can see, my hand is burnt here. So it all did happen. Okay. No doubt about that. But a small fire extinguisher, actually saved our lives. So what I request today is I want all of you to have a first aid kit kept in your house, kept in your car, kept in your bike, and a small fire extinguisher always kept in your car. That is very important, very, very important. And that will definitely either save your life someday, or someday you will save somebody else's life. And that is very important. So coming back to the wound, so you have to wash your wound. Once you wash your wound completely, look if there is any active bleeding is there. If it's not there, once you've washed your wound, you can apply a gauze. Okay. Now there are two kinds of gauze. Generally, we see cotton, let's put cotton. But the moment you put cotton, it gets sticks to your wound. Once it gets dried, right, it's too difficult to take out. It's really more painful than the wound that caused. So don't apply cotton to the wound. What you have to apply is a gauze. It's like a net, a small net which comes with a net, cotton net. So it's like a sandwich kind of thing that comes in every first aid kit. That's something which you have to put it and pressure. If you don't have, yes, you can use a clean washed cloth. You can put it and try to compress it. If it's excessively bleeding, where in terms where nowadays, there are times where you might, just cut your nerve, any veins or anything, by mistake it happens, it's breathing extensively. First thing you need to do is wash. And once you wash, you apply pressure to stop the bleeding. Once you stop the bleeding, I'll give a small instant. If something is cut here while cutting, there's excessive bleeding, you clean the area and just put a pressure. Once you put a pressure, still it's bleeding. The moment you remove, you don't apply anything around here. A lot of people say if you tie it around here, some thread or anything, that will reduce bleeding. It will reduce bleeding, but only if you have put that tourniquet, we call it as tourniquet, the tie, if you tie it here to reduce the bleeding here, it's only done if a proper pressure is applied. If a little more pressure is given, there are chances that you can lose your hand. It is that dangerous. Most of the time it happens nowadays. I know we are in remote areas. We are in a house. Some people are in a farmland. Some people are in a house. Whatever. The chances snakes can come. The chances snakes can bite you, or any kind of insects can bite you. The moment snakes bite, a lot of people, what they do, they apply a large band and tight it hard so that it should not go. It's good to do it, provided you know what is the pressure you do it. And that is very difficult for me to make you understand, because every cloth has a different diameter, different strength for you to tie it. So preferably, you don't have to tie that. Never do that. If it's not done in a right way, you will lose your limb, which is very important. We have seen it for a small, and I'll tell you guys, in India, about 80% of snakes are non-poisonous. So it will not kill you. There's only about 10 to 15% of snakes which are actually poisonous, which you need to concern of. So anytime you have any kind of insect bite or a snake bite, at that time, no video consultation will work. Any insect bite that happens, you'll have to straight away rush to an emergency department of hospital, which is very most important, because that golden hour of snake bite, from the time it bits, from the time it reacts, you have a very about 20 to 30 minutes of time. For few snake, like for example, if you say a python snake, black cobra or a black python snake, that you just, if that bits you, just do a last phone call to whoever you want to do it, because it's just like takes about 3 to 4 minutes and it's done. But good news is that particular snake is not available in India. It's morely in Africa and countryside of America, North America. That snake is bit. You just have about 4 to 5 minutes, so you can do your last calls and talk to whoever you want and say a final goodbye. So, anyways, so snake bite happens, or any insect bite happens. Like, for example, they say there's a small leech kind of a gome that comes and bit you. So any insect bite, we request you to reach to the emergency department as early as possible. That is one thing. Only if you have bruises and cuts or anything. Can you hear me?
Yes, sir.
Okay, great. Because I can see all the videos are just paused for a moment. You're able to see and hear me clearly, right?
Video clarity is not proper, sir, but audio is proper.
Okay, great. No problem. That's even good. We can look it as a podcast more than a video cast. Okay, great. So you need to, mainly is important is you need to do is not to come and call us an online consultation. It has really happened. 2 weeks back, one of my colleague got a consultation, and that person randomly called the doctor, booked an online consultation, and unfortunately, since the waiting times were little higher, so it took about 45 minutes to 1 hour. And then when the consultation, the doctor is sitting and asking, yeah, what happened? Nothing, doctor, I just got a snake bite. It's a small dot is there. I think I'm okay. And that is something you should not do. Any insect bite, you have to straight away come to the emergency department. It could be any insect bite. It is very important. That is first. And second thing, as I told you, is when the wound is there, clean the wound, apply pleasure on the wound. That is itself is enough. You don't have to tie anything to, make it more worse situation. Okay, tie a wound. Small, simple wound, abrasion wound, you can just wash it with soap, as I told you. Put a normal gauze. You can have your betadine ointment, or in terms of any kind of solutions, you have betadine solutions, you can just apply to it. Just put a normal dressing. These are emergency wounds that can happen anytime with you, with me, or anybody. And mostly, I think I would say a lot of boys will have the wound nowadays, because I think nowadays most of the boys have converted themselves to cooks at home, and I think the girls are more relaxed. The ladies are all relaxed today, so it's all for the boys here, And I believe me, I have many cuts. I know I'm a surgeon, but still I have a lot of cuts in my hands, because I'm also cooking and doing all that whenever I get time. It is good to be there. Somewhere the positive side of it is, you're now spending more time with your family. So don't feel sad that, things are bad, I want to go out. No. Believe me, guys, if you are right now with me in this gathering, believe me, you're very lucky. And to add to that is, actually speaking, my own brother who's grew up with me. He had yesterday brain hemorrhage, and he's right now fighting for his life in the ICU. So he's literally so serious that we're thinking that we might just lose him. So I'm right now with him right now at this moment. We are in the ICU. I'm right now with him at this place right close to him, where we are monitoring constantly. So this is exactly what is happening. So times are different, but still I didn't want to cancel this. The idea behind is, it's a promise I made to you. And at the same time, if I could give anything with my talk to make you understand how important it is, how lucky we are that we have, somehow survived through this so far. And I think that is what is really important. And that is what the positivity we need to have and spread. Believe me, good positivity, not COVID positive you start spreading. It's good positivity, inner self within you need to spread. I think Dr. Shilpa is, banging. I think, yeah, she's like, she agrees to what I just said. Great. So, okay. So this is how it is. So any wound that comes, insects, please visit us. That's the first thing you do. And if you have some minor wounds, you can take care of it by just putting betadine solutions, tie a dressing. Generally, a small wounds, 2 into 3 centimeters, 2 into 3 diameter centimeters, usually heal in a 3 or 4 days time. If it's a very, very minute wounds, just small cut wounds, will heal by a day's time. So don't worry about that at all. But yes, which wounds you need to be worried and which wounds you need to look into is what is very important. And that kind of wounds are diabetic wounds, especially your elderly people who has diabetic wounds, or any kind of wounds which are present for more than 1 month or 2 months or 15 days, whatever. It's there for a very long time, for 6 months. Those are the wounds which is very important to look into. So before you do anything to the wound, I stress on you to please contact us. Please contact us. You can book an appointment with us. We will first have one video consultation with you guys so that we will be able to understand that what kind of wound is this. Is it a diabetic wound, or it is because of BP, or is it because of the trauma, or it because of which kind of wound is there? That is one thing. You will say, yeah, my uncle has my grandma has a wound in her leg. It is there from 3 months, and why do I show it to doctor? Might as well do it, and we'll do it. We'll try to do dressing daily. No, it doesn't work that way. It's very important to show it to your doctor, because doctor will understand first whether there is any infection. Because if you don't treat the infection, the wound will never heal. The wound will be there forever with you. So that is something we need to look into. You need to work on your wound. So for that reason, I insist you to please have a consultation with us. So, or any doctor that matter which you feel comfortable, so that the doctor will tell you what kind of wound it is, and it will be able to understand the wound, and then we'll be able to tell you what kind of a wound and what can we do. And that will be easier for us to explain how we can manage wounds which are there from a long time, like chronic wounds. So this is what it is about when it comes to wound. So I know we started at 10:30, so it's 11 now. So I think we've crossed 30 minutes, and I would like to stop with the wound, because this is exactly what we need to do. Okay. And a lot of people have also the conception that it's a lockdown, and I think it's very difficult to meet our doctors. No, absolutely not. Like if you see most of the hospitals, including our hospital NH, we have opened all our departments, are working full-fledgedly, whether it be a gastrosurgery department, like we have an amazing team called Dr. Lokesh and his team, and whether it is a neurosurgeon team with Dr. Gautam and his team, and the multiple teams with ortho or a medicine or urology or any department that feels that you need to look into. All the departments are full-fledgedly open and working full-time, and you can always book us an appointment with any doubts you have. And small thing also I would like to finish by telling my topic for today is, you might think you have developed a small swelling in your leg. You think, yeah, my legs are a little swollen, but when I sleep, it comes down. It's okay, I'm okay with it. No, I'm not trying to scare you here. Believe me, guys, there are a lot of reasons. I'm not trying to scare or anything, and I don't want to do it, because today I'm not just a doctor for you. That is why I introduced myself. I'm also an administrator. So more or less, you can tell me I'm also a management student, correct? So with that per se, I'm telling you, even a small swelling in your leg could tell you that there could be a problem in your kidneys, or it could be a problem in your heart. It could be a problem in anything that matter. So don't take it so lightly that I just have a small issues and you just want to move it on and don't worry, I'll be fine. No, absolutely not. You need to consult the nearest doctor, whoever doctor you have with you, so that you will get a better picture of why do you have that particular problem. It could be a small swelling. A lot of people, I remember one patient that came to my OPD, he had a small pimple, a very small pimple that came in. He said, doctor, the pimple is not healing at all. It's just pimple, guys. I'm not kidding. Small pimple. I'm not saying every pimple you need to show it, but it is very important to understand how long the duration is, at what age it has come. If you're in your teenage age, it's okay. But ages where it's little higher than 40 or 30 or 40 years of age, you still have a pimple which is not healing constantly. That is something you need to look at. Because when I got a patient, small lady, a lady about a 45-year-old, she has a pimple, it's not healing. It's like, not pimple. I put acne, I put so many things. It's not just going, doctor, please help me out. Then when I checked her pimple, the pimple is so small. But when I start pressing it, I could see there's a huge swelling behind her cheek, which she couldn't appreciate because the swelling was so diffuse. It's very hard to understand in the cheek. So then when I went and investigated, I came to know, it was a skin cancer, which was actually developed and growing from inside. Again, I'm not saying every pimple is like that. Definitely not. You don't have to worry about every pimple. I'm just trying to give you an example that if you ignore the smallest of small things, it will become a huge. On the other hand, even if you Google smallest of small thing, today you say, I have cough, the Google will say you have lung cancer. you have sneezing, the Google will say that you could be probably having COVID, you could be probably having brain, some tumor or anything. So on the other hand, it's good to Google, Google will give you a picture to understand things. But Google is very vague. It's an ocean of possibilities. What your doctor is going to do is, from that ocean of possibilities, see, I'm not saying Google is wrong. Google can be partly correct, but he'll give you a broad perspective. So what I insist you is, whenever you have any slightest issues with you, it's always better to discuss with your doctor, to ask what this issue is. And doctors are, even if you have some things which you don't want to share it to anybody, you can always share it to a doctor, because doctor has that kind of clause that we don't, really necessarily tell it to other people. Like right now, I'm talking, I think around about 89 candidates today, people. And out of that, I think most of them, I think about 80% of, I think I would say 100% are young people. I can see young faces, everybody, including Sukshma as well. So everybody is looking young, no doubt. But I'm sure the youth, there's a youth right now. They will definitely have certain things in their mind which probably they cannot share it to your family members, your brothers, your sisters, your mothers. Most of the time you can, but sometimes you definitely can't. So that time you can contact us. We are here to help you in every way possible. And whatever you discuss with us will always be with us, because it's a clause. We write it, we are not allowed to share it to anybody. So you can open up with us, because the more you get opening up with yourself to us, it will be easy for us to understand. So this is what I'm trying to put into. So I know it's a very small thing, but I wanted to make it more proactively, make you understand with little bit of, examples to give you understand what wound would be and how you need to take care of yourself. Then moving on to the last segment, which I'm actually looking forward to, is, I'm more eager and happy to see all of you. So if you have another, I think about 20 minutes is less. So if you have any question you have in your wildest of your dreams, or any thoughts that you would like to share it to me, I would be really happy. And I hope I'll be able to answer your doubts, including the respected teachers and definitely all the professors who've joined us. If you have any queries, you can always ask me, and I'm happy. And Ms. Sukshma, I'm also open to you. Please, if there's any question that comes into, but I request you to please, on your video, I know you're at home, probably, you're wearing a shirt with the shorts under. I understand, we are all in the weird. Probably, I wouldn't say what I'm also wearing completely. That's something surprise. But whatever it is, I want you to open your video to show your face, and when you talk to me, so that it'll be happy for me to see people, because that is something, as a doctor, I'm looking forward to see people. So if you have any questions, on your video and ask, and feel free to ask. And I think I would also request all the teachers, if the students are going out of the way to ask, on my request, it's okay, pardon them for this 20 minutes. Let them open up themselves. If they have anything in their mind, they can openly ask us. And I'm really looking forward to see that if I can be able to help you guys in whatever way possible. Thank you so much. And we are open for Q&A now. If nobody asks me questions, then I'm going to pinpoint every name one by one, and I'm going to pick you up so that you can ask me questions. And that time, if anybody leaves the class, you lose the attendance for the whole week. And that's something I have connected with all your teachers. So don't move out of it. So either you ask me questions, or I'm going to pinpoint one by one and pick you up. And see, I can see a lot of people are already leaving. I think 4 people have already left. Chandan is left. So people are just leaving when I tell this, but it's okay. Don't worry about it. I won't pick you up, but you have any doubts, please feel free to ask me, and I'm here. This is definitely, I've taken permission from NH. I'll take this as a free consultation to First Grade College. So you have any doubts and queries, and I'm really happy to answer your queries, please.
Yeah, sir. Good morning, sir.
Good morning, Dr. Kruti.
Yeah, sir, I have a doubt. You just told me that if we insects bite, so we need to contact to the hospital. So if it is the case, if we don't have any hospitals nearby, and if it is that if we have a time constraint and a thing, so is there anything what we have to do if an insect or a snake, anything may happen?
Yeah.
So it takes time to reach the hospital. So
Correct.
is there any remedy that anything should be done immediately by the other person?
Yes, absolutely. So it's a very good question. Thank you so much for asking, Dr. Kruti. So what you need to do is I have seen in a lot of movies, if you have a snake bite, they'll take and suck and spit it
Yeah.
out. And a lot of
Yeah.
things that happens in the movies. Please don't do that, because what happens is when you do that, you end up taking the venom. So if you swallow it, if you don't have any cuts in your mouth, when you do that, it'll just go inside your stomach, it'll die, it's safe. But what if that person has some cut in his gum or some bruise? It'll straight away go into you and you will get infected. That's something which you not do. So if there is insect doesn't mean mosquitoes. Yeah, mosquitoes, you tell your mother or father, your wife, your husbands, to just take care of small scratching part or hitting and taking care of mosquito bites. Mosquito bites is something you don't need to worry about. But yes, as you say, snakes, when that happens, the first thing you do is wash the area. And the moment, for example, if you have a snake bite, when it is over here, you just wash the area quickly with whatever soap you have with the running tap water and just try to hold the hand like this. Don't press it too hard, but just hold it with a slight gentle pressure. So that will prevent from venous flow. That's all you need to do. And if possible, if it's too much cut or anything has happened, just put a small clean cloth on it, hold gentle pressure just above it, gentle pressure with your hand, not with your cloth. Okay, and then you pressure and bring straight away to us. That's the only option, and that's the only first aid you can give it to when it comes to snake or any treacherous insect bite like scorpion bites. And I know scorpions are not here in India most likely, but there are possibility that if at all there is there.
No, I have seen many people that if any insects bites, they'll put little salt and kerosene on that to heal the pain. They'll tell that we have seen, because
what happens is when you put if you put kerosene, the venom, it'll start like a petrol, it'll go faster inside you.
Okay.
So please don't do that. No putting kerosene, no putting salt, kerosene, then you put salt, then put sugar, then put haldi, and probably put some rice, make a biryani and eat it off. So that's what it's going to happen. So please don't put anything, because what happens sometimes, we really don't know what snake it's bitten, what insect it's bitten. See, I'm not against older people who tell this. Probably, or maybe they are right because of their own experience. Those generations, we don't have those things. Sometimes when you say, you put salt, it'll heal. Maybe it might heal, but our ointments will have those contents of salt in a graded quantity that will only help to protect that. Not completely. So my humble request is just put a gentle pressure on the above, clean the wound, put a gentle pressure and just straight take away to it. Generally snake bite don't bleed. There'll be only 2 holes on it. That's it. It usually don't bleed. So there's nothing that we need to worry about, but we need to see to the venom is not going way too ahead of it. Gentle pressure and clean the wound and bring us to us. That's the only way option left in this. Don't apply my humble. Yes, if you have any betadine solutions or any antibiotic or anything solutions, yes, you can slightly apply to it. But what happens is when you apply some cream or anything, if the venom wants to come out, it won't. It'll stay in and go inside. So it's better to not apply anything there. Pain might come down, but the poison will stay inside. It won't come out. So it's better to keep it open, but put a gentle pressure, clean with water and bring us directly to our emergency department.
Thank you, sir.
Thank you, Dr. Kruti.
Sabi, you can directly unmute your video and ask the questions to sir.
Good morning, sir. Actually,
Hello, good morning, Ms. Savi.
I have watched many YouTube videos. I'll explain the steps I have. They use sanitary when we are outside the city or traveling somewhere, or it can be trekking outdoor activity. And we don't have first aid as much as advanced as you said. There should be an ointment, bandages, and everything. Can a sanitary napkin not only just help girls, but also the other people at the time of need as to stop the bleeding?
Yeah, so I just repeat your question. Thank you so much, Ms. Savi. So your question was, if you don't have advanced equipments with you, like in terms of first aid, how you can stop the bleeding, correct?
Yeah.
Absolutely. So that's exactly the thing. So very good question. So what you need to do is very simple, as I told you earlier, is if you don't have gauzes, if you don't have anything, if there is a wound that is bleeding, Either you clean the wound. Once you clean the wound, you should apply pressure on the wound. Once you clean it with soap, apply pressure on them with your hand. If it's not happening, then you can take a clean cloth with this washed cloth. Okay, you can take a washed cloth and apply on it and probably keep a pressure hand over it. I have seen most of the time they apply a cloth and tie it tightly in the hand. That is something you should not do. See, I'm going to stress you. I'll give you an example how it works. Okay, for example, this is my finger. Probably I'm cutting something and I cut my finger here. So when that happens, you don't have gauze, you don't have Dettol, you don't have anything. Just wash your hands with soap. That is very important. Once you wash your hands, take a clean cloth, put it on it and apply pressure with your fingers. What I have seen most of the time is they'll put a kerchief and tie it around. See, I'll tell you very simple. If you tie it around, what happens is any wound that has cut, right? Our blood only has to go and treat it. If there's no blood going there, it will not treat, it will not get healed, So you can't completely hamper. When you do that, this part of the area, what you can see here, this finger, this area, that will become gangrene. A lot of people have happened, small cut, they tie so hardly like this. This area will become black and this area will die. This part we need to remove it off. I've seen most of the time it's happened. So small cuts you have, if you don't have bandages, apply a cloth on it and put your hand and just press it like this. Never tie anything. The moment you tie, you're reducing the blood supply. Bleeding might stop, but that area which is open, right, it will never heal. And you will actually hamper the thing. So always remember, when you have a cut, or here or anywhere, apply a cloth and put a hand and press on it. That's all you need. So only you're preventing the blood only from that area, but not the area around it, because around area should be healthy and blood should come there so that it can heal the area of that part. So that is very important. So that is exactly, use a fresh, clean cloth. That should be more than enough for a temporary. But on a long run, definitely you require a sterilized first aid kit, which is very important. And when you buy a first aid, I have seen my own friend's car. He's bought a new car with car about 7 years old. The first aid kit is still there. That 7 years old first aid kit is still there. And the question he's asked is, can I use the same kit? No, you can't. Every first aid kit has to be changed at least once in 6 months or maximum in a year. But 6 months, you need to change that kit. What I mean is whatever things are inside you have to go to the pharmacy and remove those things and put a new things to it. So every 6 months, you'll have to change that first aid kit of every, believe me, it will definitely one day save somebody's life around you. So having a first aid kit in your car, in your bike, or even when you're walking on the road, having it in your bag, small kit will really do wonders. If there's somebody's burn is there, the first aid kit will have an ointment. Yeah, that's again one more thing. If there is some burn injury happened, okay, your hand is burned, what you'll have to do if it's burned? First thing you need to do is put your hand in the water and clean the wound. Even if it's burned, just clean the wound completely. Probably wash with soap also. I know if you put with soap, yes, it will burn. If it's burning, then just wash completely with the soap and apply soframin ointment. These certain things every house should have. That is why I say first aid kit will have that ointment. Any burn is there, you can apply on it, that ointment. Clean the wound and then apply the ointment. And that will heal by itself. Small things, all you can take care of at home. You don't even have to come or show anywhere. But it has to be taken care in the right way. I'm telling you, a small cut, if you don't take care, you will lose that finger if it's not done in a right way. So thank you, Ms. Savi. It's a good question. Very good question.
Thank you.
You have any personal questions also open, because I am also studied a bit of psychology as well. So if you have any thoughts scaring you or anything, please feel free to ask. If you can answer, question me.
Very good morning, sir. I'm Dr. Shilpa. Sir, actually, it is a very informative session. Thank you so much. Actually, I have a personal experience. So many ladies have these questions, I thought. Actually, when we are in cooking area and all, we are doing cooking and all, the wheel skin has burned from the heated vessels. So suddenly, before now it is for COVID situation, we can't go for outside. So what is the primary care we need to take for suddenly skin has burned from the heated vessel, and huge heated water also skin has burned. So what is the primary care we have to take before while we are going for a hospital? Please give me some suggestion. Actually, skin has getting lot of burned, and it is color has changed, and after the burning also, after the within 5 minutes or 10 minutes, the skin has become a black color, and also it is for slum bigger, and all wound is has been happened. Any some suddenly whatever all we have applied for the skin to avoid and reducing the burning sensation, please
Nice.
give me some suggestion.
Okay. Thank you so much, Dr. Shilpa. That was so nice, and so cutely you were asking me, and I'm really happy to answer this question. Thank you. It's a very good question. It's very much needed. See, it's for everybody. It's very simple, and it's if, as I told you, there's certain steps you need to follow. If you do it in a right way, only results are good. So, for an example, as Dr. Shilpa ma'am really put it across, saying if you have any hot water poured into your hand and suddenly you have a large area, sometimes you're drinking tea and your kids will come and just push you and you'll fall that water on the kids, and then the kids will have a small burnt and everything. So that is very important. Now I will just explain to you how we define a burn. Okay, so there are two kinds of burns. I'm giving you in a simple term. First kind of burn is a burn which you can take care at home. You don't need to come towards us. Okay. And another kind of burn is a burn which you'll have to come towards us. Okay. Now I'll tell you a burn which you need to come to us. Okay. To show it to doctor as emergency to the department is any children or any kids who are less than 8 or 10 years old below, especially who are 3 years kids or 5 or 6 years old kid. If they have a burnt injury which can affect complete arm or only hand or face or neck or chest or back, anywhere, any injury, if the size is more than 5 centimeters. Okay. Now, I think Dr. Shilpa will think, how will I keep my scale ready? As soon as burn happened, bacha, just let me measure the. No. Approximately, if it's so small, it's okay. But again, it depends how deep the burn is. If the burn is looking red, when the burn happens, if it's looking red, you'll have to visit, no matter what it is. If it's a kid below 8 to 10 years, you'll have to visit us, which is very important. Okay. And one more burn. It's a small size, but it is red in color. Very red color burn is there. You have to visit us if it's below 8 to 10 years old. Okay. If the burn is normal, only there's a small swelling. Sometimes when burn happens, that ball of the liquid comes out. Like a balloon comes out in your fingers or somewhere. A small balloon comes out when the burn happens, right? If it's that is small one, if that is there, don't have to do anything about it. For that burns, you don't really need to have to come to us. But I would suggest any kids below 8 to 10 years, it's better to come and visit us and show it, because kids' calculation of burns is very high. So it's completely different than adults. Now, let's say as a teenagers, like people who are right now with us and you and us, we have these kind of burns. So when do we have to come? A burn which is completely covering your hand, okay, hand area, which is completely your hand is burned, whether it is superficial or deep, whether it's red or just balloon. If complete hands are involved, you have to visit the hospital. Okay. And for example, if you have completely this one area, whole area is involved, you still have to visit the hospital. If there's any burns on your chest, you have to visit the hospital. Even if it's abdomen, you'll have to. Legs, depending on how much. If it's a small 5-6 centimeter wound, which is superficial, you don't have to come. But if it's complete, one leg is the whole thigh is one, like full thigh, hot water is poured into it. Full thigh is damaged. Whether it's superficial or deep, you have to come. So that way we classify burns, who has to come, who does not have to come. Now the next question what I want to answer, what Dr. Shilpa asked is, what is the first aid we should do, which is very important with the burn? I'll make it very simple to all of you. There are 3 stages. First stage, any burn happens, move away from that area. Okay. For example, if there is burn that is fire through something happened, just go out of that area. Whether it's a hot pot fall into you, just move out of that room. First, you go to a different room and sit. That is the first thing you need to do. And then look at your wound. How big is it? If it's too big, yes. Then if it's red, okay, now there are two kinds. If the wound is big and there is a swelling with the water inside that wound, don't break that. Don't break that at that time when you see it. Because when you break that, you are actually infecting the wound. Leave it to us. Visit us directly. Don't do anything when the balloon happens. If a small burnt wound, when you're touching something and it burnt here, a small balloon is there, that time you can remove that balloon if you want. Small ones, small ones you can remove. Big ones, don't touch those bullets. We call it as bullets. Okay, so that you should not do anything. Yes, if you have a burn, let's say a small red color area burn is there, first thing you need to put in a cold water or running water, tap water, just put it in the water. The moment you do that, everything will wash out, whatever that. But you can't wash it with soap because it's definitely going to pain you. If it is small, you will. It's where it's little reddish is there, or maybe little skin changes happen. You can wash it with soap. But if the skin is completely gone and it's red color, then don't wash it with soap because it will really burn you. The only way you need to do is just wash it with running tap water. Once you do with running tap water, if you have any soframycin ointment, always keep this ointment. Burn ointment. You go to any pharmacy, just ask, I need burn ointment. Always keep that ointment handy with you in your house. You have to just apply that. That's all you need to do. Put it in the water and clean that area, and then just put soframycin ointment. Now, when do we apply soframycin ointment? Not only with skin completely removed. Even if it's a small burn which is red and it's paining, you can still apply. If you don't have soframycin ointment, you can use your face cream, especially SF50. Below that will not help. SF50 sunscreen, you'll have those lotions. All the ladies will understand. I have understood for my own, I have friends, so I somehow know it. So anything which is SF50 more than that, you can definitely apply directly to your wound. Some cold creams you can apply. But preferably, soframycin ointment is very much important. So that's something we need to apply on it. And if it's a bigger wound, you need to come directly to the hospital. But that big wound is there, red colors there. What do we do? Put cold water, clean it completely. If you have a clean cloth, you can just cover the cloth and cover the with clean cloth. Just cover it, not tie it. Cover it and bring it to us. If you have a gauze as first aid kit, it's fantastic. If you don't, just come directly to us.
Thank you so much, sir.
Yeah, most welcome. It's you can Google Pay me whatever it is.
Okay, sir. Thank you so much, sir.
I'm just kidding, Dr. Shilpa. Go ahead. Next question, please. I think
Sir,
we have a
good
couple of
morning,
more
sir.
minutes.
Sir, good morning, sir. This is Bhagya Lakshmi.
Good morning, Ms. Bhagya Lakshmi.
Sir, I have a question.
Yeah.
If a person is diabetic, for them, usually if there is any cut or wound, it becomes very difficult for them to cure. It takes a lot of time.
Absolutely.
So if there is a wound or cut, especially for a diabetic patient, so what are the primary measures they need to adopt? Is it like a normal people, whatever you told, the same tips can they adopt, or is there any special supervision required for them? That is my question, sir.
Yeah. Thank you, Ms. Bhagya Lakshmi. It's a very good question. So what we need to do is first understand whether it's a diabetic patient or a non-diabetic patient. Wound is wound same for everything. And the procedure, what we do is also equally same. There's nothing more different than that. There's only one thing what you need to look at, which is very important, is when there is a diabetic wound, you need to understand whether your diabetic is under control. If your diabetes is under control, when you're taking your normal medications correctly and you're checking it every 3 months or 6 monthly, or some people check it almost once in a week. So if your diabetic is under control, just follow the same protocol what we treat to do it. There's nothing different in it. But if the diabetes is not controlled, what Ms. Bhagya Lakshmi very well said is, yes, diabetic wound will not heal. It will take longer time. It takes about months, sometimes years to heal it. That time, what do we do it? That time you dial the number to Dr. Ali and you give me a call and then I tell you what to do. No, I'm just kidding. So what you do that time is you contact us, because what we're going to do is, what we'll understand is, first we'll run your blood test to see how is your diabetic control. If your diabetes is not under control, then it will never heal. So we'll see to it We'll grade your diabetes. Like, for example, in our hospital, we have the finest physicians right now. We have Dr. Naveen, Dr. Chaitanya. We have a group of, physicians who are working tirelessly during these COVID times because they are the actual frontliners, and the emergency department also. So we have an amazing physicians who will definitely help you out to help you, monitor your diabetes. At the same time, once the diabetes is under control, then the protocol of treatment is all the same. There's nothing different in it. So that's how it is about. Thank you, Ms. Bhagyalakshmi.
Thank you, sir. Thank you so much.
Couple of more questions from students will be really appreciated. Or I'm going to just choose one of you and then, I'll see to it your teachers will ask you questions. Come on, couple of more questions and then I think we'll move to Ms. Sukshma.
Good morning, sir.
Good morning, Aishwarya. Thank you.
This is totally not related to wound something, but this is something personal.
Fantastic.
Like from
one thing before, Miss Aishwarya, are you sure you want to share it in this platform? You're okay with sharing? Okay, go ahead, please. Please go ahead.
From many years, I'm practicing dance, but from past 2-3 months, whenever I practice, I get so tired quickly within 10 minutes or something, and I get severe headache, like backside. Like, what might be the reason?
Yeah, absolutely. A very good question. This is something we need to look into. Thank you, Ms. Aishwarya. Very good question that you've asked. So what really happens is, see, Ms. Aishwarya, right now, I'm so sorry I keep getting calls because I'm getting calls from probably patients or somebody. So I might just move in and move out. So yeah, so what really happens, Ms. Aishwarya, now in COVID times, we are all fatigued, right? All daily activities are not happening. Especially ladies. Gents are doing everything. Like I'm sweeping, swapping, I'm doing all the ladies' work. So no doubt. But I know there are a lot of times in these COVID times, we are not doing our normal activities. So there could be two reasons that could be a possibility of you. What I understand with just a brief sentence is one, it could be, you're fatigued because normal activities are not happening. So I would always advise whoever, because I'm a dancer myself, I do break dancing for the past 15 years. So when you say about dancing, the first thing a lot of people don't do, Aishwarya, is you need to do stretching. Most of the time we just straight away on the music and we start dancing. That's something we need to not do it. Any physical activity which is not beyond the normal capacity of usual time, you need to do stretching first, which is very important. Do all kind of stretches, which stretches all parts of your muscles for about 15 to 20 minutes. And then only your body is ready to, it's like you're heating up yourself to go for a bigger, action. So that's exactly my point. So that is very much important, is stretching yourself. And the second most important, if you really have a back pain, neck, that is something my concern, which I need to look into. It's very hard for me to understand why it is happening. Usually, I'm coming to
whenever I'm a bit angry or tensed or upset, I get severe headache.
Okay, yeah. So that means to say when you're angry and tense, you need to check your blood pressures. Why I'm saying is sometimes, see, I know you're too young for it, all of us young, but nowadays, what we've seen in older people, in our generation, younger generation. Okay, so there could be a lot of factors to it. Okay, sometimes when you're, it's not just you. Sometimes even everybody gets angry. There's possibly a headache. So there could be two reasons now. Okay, first reason, what I think is, since we are right now online classes, we're doing too much. So you're staring the screen so much. Probably you don't have a glasses, or you're not wearing your glasses, or you need to get your eye tested, because sometimes since online class is happening, we're staring the screen so much. That is why I insist all of your students don't stare at screens. See, when you're watching a class, when you're listening to a teacher who's talking without presenting anything, close your eyes. When he's presenting, open eyes. And once your classes are over, please don't use your mobile phones. I've seen my own friends, once you finish your online class, you go back to your phones and you go Instagram and you're Instaing, reeling, and you shop on YouTube and all that. So don't do all that. Give rest to your eyes. Your eyes need rest. Because if you don't give eyes rest, those headaches will start. It's called migraine. It could be thrombotic. It could be different kinds of migraine. And second thing, when you said the neck pain, it could be one more reason is, technically, all of us should not use any pillow. Even if you use a pillow, we should use a very thin pillow. So thin that it's like a bed sheet. It should be a very thin pillow. This is very important because you need to tell it to your family, your mother, your father, and your parents and everybody. Because sometimes when you use heavy pillows, later stages you'll have cervical problems And I've seen a lot of cases in our hospital, they come with lumbar problem because, using of pillows. So always your head should be straight lying down posture. This is your head and this is your body, it should be like this. If you use a pillow, it will become like this. So your neck is flexed the whole night. So that is very bad. Now, it doesn't mean that your mom and dad are sleeping in the room and you just open the door and take the pillows and run away. Don't do that. That's not required. But yes, you need to tell them that it's better to use lesser pillows. But still, Aishwarya, if you really have these on and off, it's always better to consult us. Like for example, the kind of problem you're doing, you probably need to meet a neurologist. Like for example, we have a neurologist in the hospital by Dr. Arvind, who is actually an exceptional neurologist right now, and who will definitely be able to help you out. If you just go to our online podium, I request you to kindly meet a neurologist who will help you with your case and see because constant headache is something we need to look into post-journal. But whatever I said to you in terms of stretching, in terms of not using pillow, if you do all this for a week and see if you're able to feel better, if you don't, please visit the neurologist and probably take an online consultation and get a better understanding. That way, one sentence is hard for me to guess. Yeah. Probably last two questions.
Thank you, sir.
Thank you, Ashwin. Thank you. What I picked this time. Let's make it more interesting. Okay, if all the teachers are okay, then I'll pick somebody who can, What, Sukma? Do you think I can pick somebody?
Yes, sir. You can.
Just for fun. Okay. What about Mr. Harsha Vardhan? I don't know. So great. That's good sportive.
He's Dr. Harshavardhan, sir. He's the faculty.
Oh, I'm so sorry, sir. I'm so sorry. Okay.
It's okay, sir. I was listening patiently. It was very educative. Please continue the work.
Thank you, sir. Thank you. Okay, great. So, sir escaped because he's a faculty. That's okay. So let's go with, how about Nirmala P? Is that a student or again faculty?
Student.
I hope she doesn't leave the meeting. If you do, then, all the teachers are looking. Or maybe they're rushing to go, I don't know how. The 5 people already left. Okay, let's not do that because I want to. Oh, there's a lot of people. Okay, yeah. Somebody raised your hand. Go ahead, please.
Ashna Kumar.
Sure. Yeah, please go ahead. But I'm coming back to you, Nirmala.
Asha, you can unmute video and ask the question to sir.
Yeah. I guess he just wanted to give me high five. Raising hands means giving one. So yeah, okay. If that's the high five, I don't mind. Okay, any last questions? I mean, it's 11:40. I don't want to miss your classes if you have following classes. So any last questions? And I'm happy to answer.
I have a question, sir.
Yes, Miss Bojamma. Tell me.
Sir, why
It'll be great if you can. Bojamma, it will be great if you can on your video, please. If that's okay.
I'm on my video. Sir, due to network, I think are not visible.
Okay, no problem. Please go ahead, Ms. Yeah, please go ahead.
So why does this skin rashes happen? Like, does it affect?
Ms. Sukshma, did you hear anything? Because I don't know.
No, sir. Actually, Bojama, voice is breaking.
You can just text if you want on the text box. If at all, I can, because we can hear you. I think but I will definitely answer your questions because yours probably, let's take it. You can just type your message and I will answer it. By the time she types, I'm just sharing you I think I've got my mobile number. I've shared my personal mobile number to all of you. So I know it's difficult for me to, take up everybody's call. But if you're in WhatsApp or Telegram, you can always message me if you have any doubts regarding anything. And I will be happy to reply to you as early as possible. And I'm really looking forward to. And if you have any queries, you can always get back to me with my mobile number, which I've given you, and happy to answer. Okay, so we have a question here from Ms. Bojama. It says, why does the skin rashes occur? Okay, yeah, skin rashes. Okay. So again, yeah, thank you, Bojama. It's a good question. Usually happens skin rashes, right? So different kinds of rashes you can see. Okay, there are different reasons to it as well. Okay, so first reason could be because of your diet. Probably if you're eating or if this question can be regarding you or it's your friends or your family members, whoever it is. If they're eating food, you need to look into the food. Some people are allergic to few things, right? So you need to understand what kind of food you're taking which is causing you allergic. So that could be due to allergic reaction. That is one thing because of the rash. Second thing is because probably you're taking some kind of medication. If somebody is taking some kind of medications, that reaction can also lead to a rash, right? And the third thing is the reason for rash could be because of sunlight exposure, because of too much of heat or the atmosphere you are in. That could also lead to a rash. Or it could be some kind of insect bite, small mosquitoes or some kind of bites, we don't know, and you start scratching it, and after 3-4 days you see that as a rash. So that could be a rash. So if I really need to understand, if you want to know, does it has any effect? It depends on what kind of rash it is. If it's an allergic rash, or is it a rash due to following trauma or due to any kind of medications you've taken, or it's because of skin rash because of sun, I need to understand that. For that, I need to see the rash. For that, it brings back to me to stress on you that any rashes that comes into your body, it's very much required to consult a doctor, because small rashes in your abdomen as well, anybody who has abdomen rashes, can be any problem inside your abdomen, which is a reason why you have a rash. So it's very important to evaluate. So for me, if I need to understand, if I have to give you any kind of advice on rashes, if you have any rashes, it's better to consult a doctor. A dermatologist will definitely help you out in terms of rash. Yeah. I have another question from, I think, Ms. Javita says, sir, you said that we have to wash a wound, but some says that don't put water on the wound, it will help us. No, so it depends on what kind of wound it is. See, most of the time, why we say to wash with water is, for example, like you have kids falling on the park. Suddenly they fall, right? They have a scratch or abrasions. If they have an abrasion, there'll be mud stick to it. So you have to wash it is mandatory to wash it. When they don't see what your question is very valid, is when you don't have to wash the wound is when you're treating the wound, like diabetic wound or chronic wounds you have from a very long duration of time, and those kind of wounds you'll have to treat it. That time when you're treating it, you should not apply water, because that can form a pus. It's a very true. But if you get a wound, like right now you got hurt, right now you got a wound, you have to wash your hands. But once you got a wound or a diabetic wound or any wound and you're treating it conservatively, that time you should not apply water. Yeah. Yes.
Good morning, sir. I'm Nagashri. One of our students has posted a question in the chat box. Even I have that doubt. Even I have watched in many YouTube videos where they use sanitary napkins also as one of the first aid materials. When there is shortage or somewhat like that. Can sanitary pads be used?
Yes, absolutely. If it's not used, if it's new, definitely you can. Yes, you can use that as the emergency factor. You can. Absolutely, yes.
Thank you, sir.
Yes, you can. It's a very good question, and it's definitely you can, because that's one of the cleanest thing which is there. And that's as an emergency way, you can use it. Should not be a problem at all. Thank you for asking. Good question.
It was Savi's question, sir. It was one of my students' questions. She has posted that in the chat box. And I felt that like it was relevant to ask you.
Thank you so much. I'm so sorry we didn't see her. I think she already asked question orally, so I was not sure this was a second question.
She
it
was
was
the
second
one.
question. Okay. I thought it's the same question. She would have written it as like maybe. Okay, I'm so sorry, Ms. Savi. Yeah, thank you. It's a good question, and yes, you can use it, definitely. All right. Okay. Sukshma, over to you.
Oh. Okay, wait. Any questions? Faculties or students?
Ma'am, I have a question.
Yeah, please.
Good morning, sir. Sir, I saw many of the people, they use Colgate on their burn wound. Also, they used to cut potato in half and they used to rub on that burn area. So, sir, it is the right way of first aiding a burn wound.
Hi, good morning, Anjali. Thank you. I'm sorry, what did you cut, you said? I didn't hear that point.
Sir, actually, I saw many of the people, they use
Yeah.
Colgate on their burn wound.
Oh, no, absolutely. Yeah, see, yes, some people say you can, but the problem is any kind of burn, my humble request is the moment that happens, just wash your hands. The moment you wash your hands, apply a clean cloth, cover it, and bring us to the emergency department. If it's a big wound, if it's a small wound, you need to have a first aid kit kept. Just apply soframycin ointment, and that itself is more than enough. And that is why I'm insisting, probably from today onwards, I request all of you to have a first aid kit. See, I understand, a lot of people say, so we don't have this. Can we use, Colgates, or can we use that? Can we use? Guys, we are living in 2021, right? Today, those days were used, the reason behind, because those days were not available. So those things, they were trying to use all, those kind of materials which were not available to them. And, one medical store was about hundreds of kilometers away, and, going and getting for small, and they wouldn't. And that's why they use all this. But today we are so highly technologically driven, and probably today, one of the take home messages you need to have is everybody should keep a first aid kit with them. Because that event should not come where you end up using a toothpaste. See, I'm not saying it's wrong. Probably some science says it could be okay. But my only suggestion is you don't need to go to that level. You need to have your first aid kits everywhere, at least with you one. So that way, anything that these things can go wrong, especially ladies I've seen, they carry purses, right? You can always have a small first aid kit kept in your thing, and it's really help you out. And that is the only suggestion I would give, Ms. Anjali. It's a very good question, though. First aid kit is the key to thing. Yeah. I think we have one question. I don't want to miss out any questions because, everybody is important to us. So there's a last question. Let's take his last. I've shared you my mobile number, guys. So guys and girls, you can always just text me if you have any doubts. And I'll maybe not instant, but I'm happy to share your doubts. But I can take this last question. I think Shrindi says, how to remove a foot corn, what treatment we should take? Yeah, of course. Good question. So how to remove a foot corn? So again, we need to understand what kind of corn. We get corn caps. There are a lot of things and ways to do surgically removed, or you have bandages and can remove the corn. But for that, you need to do an online consultation because we need to see that corn. Only if we're able to see foot corn, you don't really need to come to hospital. You can do an online consultation to a doctor, and that way we can able to see what type of corn, which corn it is, where it is, how it is located, how long it is there, and then we can accordingly give you some suggestions on it. All right, so I think that's about it.
Hello, sir. I'm Tanya.
Yes, Tanya. Please go ahead. Tanya.
I have a question that all of a sudden I got leg pain, sir. I couldn't bear that pain. Somebody says that because of the sweet potatoes and potatoes, it will occur. But what's the reason of that, sir?
Okay, thank you, Ms. Tanya. Fantastic question. So you are saying if you have any sudden pain in your leg. So again, it depends on why it has happened, how it has happened, since how long it is there. So to be really honest, to be blatantly very open to you is if I need to understand, I need to understand more questions from you. Okay. See, certain things like basic things I can openly say in 1 or 2 sentences. But if you have sudden burning in your leg, I suggest you to, I need to know more questions. For that way, I need to have 10 or 15 minutes time to understand since when you have, how long do you have, is it one instant, if it's a multiple instant, then I need to know some personal history about you in terms of if you have any other issues in your thing or all those things. Only after understanding all those things, I'll be able to come to a conclusion to tell you that this could be a reason, because there are hundreds of reasons for burning in pain. So Tanya, that's exactly what I said. I'll be happy. I've given you my contact number. I'll be able to at least guide you. And if I understand exactly what your issue is, then maybe what I can do is I can help you to connect to another doctor in our hospital. And then that doctor can, directly you can consult the doctor and you'll be able to help you out in that. And yes, and one thing I can tell you, these are some things which you should not take it lightly. It's always better to show it to a doctor, which is very important, because if you tell me, I'll understand everything and then only I'll be into position. So I would say it's a good question, because that will help me explain to all of you that don't take small things lightly. It is very important to share it to a doctor. and then we will see what I can do. Anyways, I've shared my number, so it should be helpful for you.
Thank you, sir. I definitely pin you.
Yeah, sure. Thanks, Ms. Tanya.
Sir, I have a question.
Okay.
Sir,
yes.
Sir,
yeah.
Can I? Sir,
yeah, please.
Okay. Sir, we're still suffering from the coronavirus, right? People after getting vaccination, still people are suffering. If the virus even gets mutated, like a new strain comes in a third wave, can we really have a solution, or can we really find a vaccination? Do we have cure?
Yeah, okay. So thank you, Mr. Vishnu. It's a very good question. So the thing about this particular thing is, see, honestly, this virus is very new to all of us, including doctors, including scientists. It's new to all of us. So right now we are trying to study how many kinds of multiple strains which are available and how long it's going to go and what it's going to take. Okay. So when you ask about vaccine, definitely it will be helpful because the vaccine is an immune therapy. No matter which strain it is, but at least it will help your immunity to tell there is something like this particular. See, every vaccine has a family, okay? Coronavirus is one family vaccine. Another virus is another family. So multiple viruses. So if one family member, if you've instigated to your body like a vaccine, at least a body will be prepared, maybe a higher variant or different variant. But this particular family person is coming to us. So you're just trying to prepare your body. So definitely, yes, vaccine is very important. But second thing is it going to really helpful in a mutating virus? Yeah, I mean, it's definitely an immune therapy. So I insist, all of you should take vaccines when your time comes. And it's very important. And also secondly, if you ask me when it's going to end, I hope it ends as long as we are thinking it should be. We already started in Delhi. The third wave has already started mildly. And also we are, with all the calculations, we are expecting by October end or November first week, we should be finishing with a third wave. And that happens, there are 4 or 5 waves remaining, but that will be very small. It will be very negligible. We won't know. But I think third wave will end up in somewhere around November is our expectations. But again, as I told you, we are very new to this. We have no idea how this virus is thing. My only scare is not virus, coronavirus. My scare is, are we sure that is this the only virus, or what if after 5 years another virus comes in? Because now people have understood it's so easy to, it is so easy to bring up a virus now and create the whole world to go pause mode. Nobody's playing, it's all in pause. The whole world is stopped, right? So my worry is not coronavirus. My worry is, what if after 5 years another virus comes in with some other country instills, and wants to create this kind of issues. So my humble request as you students, think out your minds. Become an entrepreneur. Try to find a solution. If again some other kind of virus comes, how can we prevent it? How can we work on it? These are the things I want all of you to work out. Come out with some nice strategic plan, an app, or software, or hardware, or thought, or research, or anything that can not prevent us from present pandemic. Present pandemic is almost will be coming into an end very soon. Try to see how we can prevent the future pandemics that can come. Imagine. Just to wildly, I'm telling, what if 5 years down the lane, another virus comes that affects your skin? This time it's affecting your nose to your lungs and you're wearing mask. Imagine a virus that comes on the air that affects your skin and enters through your skin. Then all of us have to wear PP kits and walk around. We can't go out of the house. So that times can also come. So that is what I'm worried about. And as you students, being science and commerce students, should come up with something with your dissertation or research or whatever possibility to how to prevent this virus again. That is something all of us have to work on, and that is something we are all looking forward to.
Thank you.
Thank you, Vishnu. Yeah, Sukshma, I think I have shared my number so they can contact me anytime. Okay. Just text me. Calling will be a little difficult for me, but you can always text me. So I'm happy to help you. Yeah.
Sure, sir. Thank you so much. And now that we have come to the end of this session, it gives me an immense pleasure to acknowledge the encouragement by the management to all of our initiatives. I express my sincere thanks to resource person Dr. Mir Zeeshan Ali for this wonderful presentation. Thank you so much for sharing your thoughts, ideas, and your questions, sir. Thank you, sir. My sincere thanks to our beloved principal, Dr. C.J. Priya, for our extended support. Thank you, ma'am. I also thank Mr. Sundaresh MP, Senior Marketing Executive from Narayana Hospital, Mysuru, for his kind support to arrange this webinar. I also thank my dear staff and students. On behalf of HFGC, I thank all the participants for attending this webinar in order to making the session even more successful. I request that you to fill out feedback form. I thank you in advance for your comments and suggestions. Thank you one and all. Thank you.
Thank you so much for having me, and it was a great honor and pleasure to have all of you here. It's a fantastic and beautiful faces to see you all, and it makes me feel really happy to see you all. As you know, this is what we are fighting for. This is what we are living for. But my humble request is, two things. One, please wear your mask. Wash your hands when you go out and come in the house, not more than that. And stay about 2 meters distance and take the vaccine when your turn comes, which is very important. And any issues we have our online consultations. You can always call us 24/7. We are always there as an NH, as a family of NH Narayana Health. We are always there to help you, support you, protect you, and guide you to whatever best of our knowledge we can when it comes to healthcare. And at the same time, as you, the youth of students and teachers, thank you, all of you, to have me. And for the small message for all the students, guys, girls, please come up with something really good. Do something really good in your life. Keep yourself clean, keep happy, and most of the time, most importantly, stay happy, stay safe. And please, my humble request, you are the future of our country, and I want all of you to do something really outstandingly brilliant to keep ourselves proud, your teachers proud, and be the best of the best people and do the best in your life. Thank you so much for having me, and a fantastic. Stay safe, stay healthy, and stay happy. Bye-bye.
Thank you so much, sir. It was
Jai
a
Hind.
very informative session, sir. Thank you so much.